name is Mathew, although most people call me Jejo. I'm one of the orthopedic surgeons here at Ortho Atlanta, specializing in adult reconstruction or total joint replacement. I trained at the University of Kansas for about 4 years, and then did my training at the Campbell clinic in Memphis, Tennessee for 5 years, and then did another year of training at the Northshore Orthopedic Institute in Chicago, Illinois, specializing in joint replacement. I specialize in joint replacements, I think more so because seeing the quality of life it brings back to patients, whether it's taking an arthritic hip or taking an arthritic knee, and patients that can't walk in their grocery store, they can't go to a CVS or a Target or a Kroger, being able to have them do meaningful activities such as that, or meaningful activities with their family. And at the end of the day, quality of life is all that matters. I think the thing I enjoy the most about working with patients is seeing them after surgery. And I say that because, yes, of course, surgery is what I do. It's what I have the most fun in. But I think establishing those relationships with patients after the fact and kind of seeing where they go in their journey and their recovery is probably the most rewarding part. So I think the way I approach patient care and overall communication with patients is establishing a relationship. Anytime I meet a patient for the first time, I'm going to spend as much time as I need to understanding what's going on. And I think the overall goal of why I take care of patients and when I talk to patients is formulating a plan. So when a patient comes in with an issue such as arthritis in their knee or hip, I'm going to talk about their x-rays, what's going on in terms of their quality of life, and then kind of go through the entire spectrum of treatments, whether it's non-operative interventions, talk about therapy, medications, injections, the simple stuff, things that are not surgical. And then obviously we talk about surgery as a potential option. But at the end of the day, I tell patients, despite me being an orthopedic surgeon, I don't want to do surgery if we don't need to. And I think the most important premise is doing surgeries for the right reason, because at the end of the day, it's the patient's decision. It's not my decision. It's working with them and working as a team, because my job is to do what the patient wants, and that's all that matters at the end of the day.